Representative Liebling moves House File 1758 be laid over for possible inclusion in the Health and Human Services Omnibus Bill. We have the bill before us. Representative Liebling. I see no amendments to your bill. Representative Liebling, you have one testifier and your bill.
Thank you, Mr. Chair. And actually, I have another testifier as well who would like to say a few words. But members, first of all, Mr. Chair, thank you very much for hearing this bill. We've heard a lot about that we are looking at we have kind of an uncertain future in terms of what our funding is going to be for health care and health and human services. And I think it's especially important for us to focus on things that are going to save money down the road. And this is an area where I think the evidence is very clear that by putting some money in at the front end, we can save a lot of money on the back end. So there are approximately 300 new HIV infections every year in Minnesota, new infections. And that is very costly because every new infection it costs around $400,000 for the lifetime cost of dealing with that disease in that one person. So we're talking about $400,000 of publicly funded medical care for the most part. So every year that would add about $120 million in publicly funded medical care. So if we can get ahead of this and head off these infections, this would really save us a lot of resources that we could use in other areas. So the bill is for prevention grants, and it's for $1 million in 2018, $1 million in 2019. That would be for competitive grants to do some things that, as I understand it, there's pretty good evidence-based interventions that can be done that can try to prevent new HIV infections and head off the human cost, but also the fiscal cost. And that's all I'm planning to say. I'm going to turn it over to my testifier and let him give you a brief story about his experience with this issue.
All right, Representative Liebling, welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Thank you, Mr. Chair. My name is Nick Denning. I grew up in Crosby, Minnesota. Growing up there, I was not exposed to anybody living with HIV. I was unaware of any risks or potential transmissions that could take place. After high school, I joined the Army National Guard as a paramedic. I then moved to the cities in 2004. I was introduced to a small group of friends, and in that small group of friends, I had met my first person who was HIV positive. I kind of avoided that individual. I was unaware of how the risk of transmission took place, so I decided avoiding them would be safer than to approach the unknown. So then, on December 13th, 2005, I was diagnosed with HIV at the age of 21. I had reached out to a program at the Minnesota AIDS Project called Positive Link. It is a group that helps people living with HIV, both men and women. It is funded by the Minnesota Department of Health. This program offers a number of supportive services, including support groups, social activities, and one-on-one individual meetings. And the demographic at that time was not what I wanted it to be. I was 21 years old. The main demographic of that program was probably age 50 and above for men who are living with HIV. So I avoided going to those social activities due to the fact that there wasn't really any resources for people around my age that I was aware of. After about 3 to 4 years of suffering from severe depression and feeling very alone, I decided it was about time to start medication. Again, I reached out to the Positive Link program, met with the current coordinator, or the coordinator there, and he had told me about the number of things that I can anticipate while going to the doctor to get set up with meds. Talking to him really kind of changed a lot of my perspectives. I started learning more about the disease and how it's transmitted. And in doing so, I became pretty active with the Minnesota AIDS Project. Currently, I am now the coordinator of that program myself. I meet with a fraction of the people who are diagnosed with HIV on a daily basis. unfortunately, there are a number of people who are still left out in the community who are not being reached, especially communities who are very underserved. So this bill would definitely allow for more testing, outreach, and education to specifically those underserved communities. Thank you for your time.
Thank you. And we have another testifier. Welcome to the committee. Please introduce yourself and proceed.
Chair and committee, my name is Matt Tobier, and I'm the Public Policy Director at the Minnesota AIDS Project. And as Benjamin Franklin said, an ounce of prevention is worth a pound of care, and that's really what this bill is about at the end of the day. Given the dramatic progress in HIV/AIDS prevention and care, Minnesota has the exciting opportunity to achieve an end to AIDS. While advances in antiretroviral treatment have dramatically improved the quality and length of life for people living with HIV, similar gains have yet not been achieved in HIV prevention. However, with proven prevention strategies for HIV-negative people at high risk for infection and targeted interventions with HIV-positive individuals who are out of care, we now have the necessary tools to stop and ultimately reverse the epidemic. Inadequate state funding and recent reductions in federal funding for HIV prevention threaten the significant gains Minnesota has made in fighting this epidemic. Minnesota's state funding for HIV prevention has been flat since 1998. In addition, Minnesota has lost over 40% of federal prevention funding in the last 5 years, significantly impacting our ability to combat new infections. Increased prevention resources for targeted, high-impact interventions can be used to quickly test, diagnose, and link into medical care the estimated 1,100 people in Minnesota who are HIV positive and unaware of their status. In addition, funding is needed for increased interventions with the 40% of all Minnesotans living with HIV who are currently not in treatment to find and link them into care and medications. Increasing activities in these two areas will lead to a significant reduction in new infections. We have the know-how, tools, and ability to close these gaps. What we lack are the resources. By investing in HIV prevention, we can save taxpayers money, we can save lives, decrease new infections, and we can reduce health disparities that are unacceptable and unjust. With increased prevention, we can continue the vital progress to eliminate HIV in Minnesota. Together, we can once and for all end AIDS. Thank you for your time and for your support for 1758.
All right, thank you for your testimony, Mr. Tuberin. Are there questions? Representative Murphy.
Thank you, Mr. Chair. Mr. Toberon, thank you for your testimony. $1 million in each fiscal year is a big round number, nice round number, and I am curious to know if you believe that this is an adequate amount of funding, if this is the amount of funding that could actually get us to the goal that you're describing, which is to end AIDS infections here in Minnesota.
Mr. Tuberin.
Mr. Chair, this is a start. This would get us on the path. It certainly wouldn't get us all the way.
And Mr. Chair,
Representative Murphy.
thank you very much. If you were able to write that number, what would it look like? And if you don't know, it's okay. I'm really trying. It is when there's a condition like this that is preventable with early intervention. You know, it's good for humans, and it's good for our healthcare delivery system, and it's good for our healthcare budget. And I don't know to the scale that you're describing. So if you don't know, it's okay, and I understand. You know, we're in a budget hearing. But I am curious to know what it would take for us if we wanted to really reach that goal. What would it take for us to invest to get there?
And Mr. Chair and committee, there are a number of national estimates that we could use to sort of get to that number. And there is a national HIV/AIDS strategy that lays out goals on how we can get to that path. For those of you on the policy committee tomorrow, you'll be hearing a bill that we're working with in collaboration with the Department of Health in order to develop a strategic plan to specifically hit those goals and to come back to the legislature with specific policy and funding recommendations to reach exactly the goals that you're talking about.
Thank you, Mr. Chair. Thank you.
Thank you. Other questions? Is there anyone from the audience who'd like to testify on this bill? Final thoughts, Representative Liebling.
You know, I know that HIV isn't always the most popular cause, but I think that there are a few things that we actually can do to save costs in our system, and there are things that we can be doing in this area, and now is the time, because we want to be able to in the future, have our, obviously, we all know that we're going to need resources for people who are elderly, for people with disabilities, and if we can intervene at the front end of some of these conditions and really make a difference, I think that is a really good use of our funds. So thank you, Mr. Chair.
Thank you, Representative Liebling, and thank you to the testifiers for coming and presenting us with your testimony today. We do appreciate it. With that, House File 1758 is laid over for possible inclusion in the Health and Human Services bill, omnibus bill.